When we look at the driving records of teens with ADHD have more fines than their peers, and they have higher points on their driver's licenses than their peers. And when they have to take remedial driving lessons, they need to take them for longer periods of time. So together, this research suggests that the kinds of citations that teens with ADHD are receiving are more severe than the types of citations that teens without ADHD are receiving. And newly licensed teens with ADHD are three and a half more times likely to drive under the influence than teens without ADHD. Okay, so if you weren't nervous about your teen driver before this, you probably are now. So you may be wondering, all right, well, what increases risk for these driving problems? I categorize these risk factors into three sort of components. One is individual factors. So some of the research we've done has identified that teens who currently meet diagnostic criteria for ADHD are the teens that are at risk. So some of you might have children who were diagnosed in elementary school, and their symptoms have lessened over time with development, and the impairment associated with those symptoms has reduced because they've learned strategies to manage their symptoms. So those children, as teens, don't have higher risk for driving issues. It is the teens who continue to meet diagnostic criteria for ADHD who have those issues. Specifically, if you might be wondering, is it the inattention that puts them at risk, or is it the hyperactivity, impulsivity that puts them at risk? And there's evidence that both of these symptom dimensions contribute to higher risk of driving issues. About a third of children with ADHD also receive a diagnosis of oppositional defiant disorder or exhibit rule-breaking behaviors. And those behaviors and symptoms increase risk. And that makes sense. If you have a kiddo who resists rules, who breaks rules frequently in other contexts, then it's more likely that they might break driving rules as well, that put them at higher risk for a driving issue. Interestingly, depression carries its own independent risk. I'm not aware of any research that looks at the comorbidity between ADHD and depression and its risk associated with driving, but we do know that depression on its own increases risk for driving issues. And the same goes for autism spectrum disorder. We know that independently, ASD is associated with greater driving risk and driving problems, but we don't know much about the comorbid presentation of ADHD and autism spectrum disorder. And then finally, we really don't know much about anxiety, again, and ADHD and its relationship to driving, but we do have some evidence that certain anxiety disorders do increase risk for driving. Relational factors also can increase risk. So if your teen has friends who break rules often, they are also more at risk for driving issues. And that makes a lot of sense. Parent factors can also influence risk. So parenting behaviors outside of the driving context, like monitoring, just generally knowing where your kid is, where they're going, who they're going to be with. Low levels of monitoring are associated with increased risk. And then having higher levels of parent stress, and this might be related to monitoring. If you are a parent who is very stressed out, then it's going to be harder to keep track of and stay on top of monitoring your teen. Environmental and contextual factors also increase risk. So a driving simulation study with drivers with ADHD found that monotonous roads, like highway driving, increased risk. And that makes a lot of sense. They're pretty boring. These are boring situations. And so they don't pull the attention of the teen driver. So if you live in a rural area where there's not much around in the driving environment, there's not a lot of stopping and going, then that could be a risk factor for your teen. Distractions are a risk factor for everyone, teens especially, and then teens with ADHD as well, because teens with ADHD already are experiencing challenges with driving. If you add distraction on top of that, then it makes that more difficult. And some of you asked questions before this webinar about automated driving systems. And this question is a complex one to answer. So in some ways, automated driving systems increase risk. And the reason for this is that it takes, again, the sort of the attention and effort needed to drive actually increases driving skills for folks with ADHD. So when we take out that sort of motivation to do it, teens with ADHD drive worse under automated driving. So there's two ways that this was measured. One was attention maintenance, or being able to keep your eyes on the road. That's just a fancy word for that. So they looked at how does automated driving affect someone's ability to keep their eyes on the road. And they found that for individuals, all individuals, whether they had high or low symptoms of ADHD, using an automated driving system led to longer glances away from the road. And later we'll talk about long glances and their relationship to ADHD and driving and how they're problematic. Another study looked at hazard anticipation. So how does automated driving affect one's ability to anticipate where there might be a driving safety event? So we all might have in our own community an intersection where many people kind of roll through that intersection. And as an experienced driver who has good hazard anticipation, you likely do something to make sure that you pay attention in that moment. So you likely, as you're pulling up and stop, wait a little bit, take a beat and see what that other driver is going to do before you go through, even if you had the right of way. That's an example of good hazard anticipation. Automated driving systems reduced hazard anticipation for all drivers, whether they have low symptoms or high symptoms of ADHD. So again, this is another risk factor. In that same study, they looked at driving, other indicators of driving safety. One of them was driving speed. And so while the automated system reduced hazard anticipation, it did reduce driving speed for folks who had high symptoms of ADHD only. And the difference in driving speed when they were using an automated driving system versus not, the authors reported, was the difference between a fatal crash and a non-fatal crash. So automated driving systems in many ways present as a risk factor, but in some ways might be a protective factor. So it's really difficult to know right now whether or not this is something that, could be consistently used for folks with ADHD. So then you might be wondering, well, what can I do to decrease the risk? Well, at the individual level, stimulant medications, there's been many studies that show the stimulant medications improve the driving abilities of individuals with ADHD and reduce crash risk in naturalistic driving. The important thing to note here is that they're only going to be effective while they're active in your system. So we know that some stimulant medications can take a while before they go into effect after you've taken them. And so you want to wait until, you might want to wake your teen up early so that they take their medicine in time for them to have it in their system when they're actually driving to school. And similarly, when teens are driving home from school, that might be another gap. Their medication, if it's a long-lasting medication, might be wearing off at that time. So it's important to talk to your pediatrician or prescribing doctor about that, about the fact that your teen is driving and that you want to make sure that they have good coverage while they are driving. And they might have some ideas for what to do about that, including a booster. Another factor that decreases risk. So I talked about parents as a potential factor that could increase risk, but the good news is that we can also decrease risk. So children and parents who had a stronger parent-child relationship had fewer driving issues. And this was pre-driving age. So it's important to work on that parent-child relationship early in development. Parents who had lower stress levels also were reduced risk for driving issues. This one is really important to start thinking about early as well, parental modeling of road safety. So talking to your young children about the importance of paying attention while you're driving, saying out loud that you're going to put your cell phone away so that you're not distracted when you get in the car. You know, not answering that phone call while you're driving, just showing good modeling of safe driving. And then setting clear limits for road safety with your teen. Be really clear about what you expect. No cell phones while driving. No peers in the car until a certain age or a certain level of experience. Definitely no driving, you know, after taking substances. So setting very clear limits. And I'm going to give you some tips for how to do that. And then under environmental or contextual factors, again, the driving environment. So a driving environment that is more engaging, like you know, stop and go, urban, city driving is actually more engaging to the teen, and they're more likely to drive more safely. And then using, though I know many cars don't have a manual transmission anymore, using a manual transmission car actually is protective. We saw studies have shown that driving is better and more safe when teens are using a manual stick shift car versus, you know, an automatic. So these are simple things that you could do to reduce risk in your teen.